Hi everyone, I'm Dr. Mahi and now I'm going to explain you about autonomic nervous system and the cholinergic drugs very clearly and briefly. Okay, coming to the lecture. Parasympathetic nervous system. Yes, I'm asking a basic question. From where the parasympathetic nervous system arises? Yes, generally the nervous system is divided into central nervous system and peripheral nervous system. The peripheral nervous system is divided into ANS and somatic nervous system. From this ANS, the sympathetic system and the parasympathetic system had came. What the parasympathetic system does? It's a relaxing system. We must say it is a relaxing means it relaxes us. Everything is gets relaxed. If you fight, it relax like that. Okay. Here, if you see, works to save energy, aids in digestion, and supports restorative resting body and functions. Decreases in heart rate, as I am saying, it's relaxing. It helps in decreasing the heart rate. Increases gastrointestinal tract tone and peristalsis movement. But it here, it's increasing the digestion rate. Okay, urinary sphincter relaxation, and again it's relaxing vasodilation, decreasing blood pressure. If heart rate is decreased, automatically blood pressure is decreased. If blood pressure is decreased, why it is decreased? Vasodilation had been occurred. Okay, it can be remembered in that way. Body responses: rest and digest. Dilation of blood vessels in skin. Yeah, I previously said it helps in the dilation of blood vessels. Decreases heart rate, causes bradycardia. Increases secretion of digestive enzymes, so that it helps in digestion. It does only one thing favor, it increases our digestion process. Constriction of smooth muscles and bronchi. If you see, it helps in the constriction of smooth muscles of bronchi. Increasing sweat glands, cooling. Contraction of smooth muscles of urinary bladder. Okay, contraction of smooth muscle of skeletal system. It helps in contraction. Okay. Actually, what is the main part is we must know the receptors, because why I'm stressing to know about the receptors, because we are going to study the drugs which binds to these receptors and how they produce the pharmacological actions. Actually, these cholinergic receptors are classified into five types: M1, M2, M3, NM, NM. Okay. First, M1. These are on the secretory glands. Where have the secretory glands? Like gastric glands, autonomic ganglia, CNS. What these do? Increase salivation, sweating, lacrimation. These increases the secretions. What have the secretion in our body get increased when we are able to stimulate the M1 receptors. M2. As we are using the M2 receptors, this is the most important receptor used in the cardiology, because it is able to manipulate the heart rate. Okay, if we stimulate M2 receptors, this decreases the heart rate and cause bradycardia. Yes, this is important because in a person like what can we say? If a person is having a hypertension, if we able to stimulate the M2 receptor of that person, we can automatically decrease his heart rate. M3 receptors, these are present on the smooth muscles like gastrointestinal tract, respiratory tract. Contraction of smooth muscles. Okay. And people ancillary muscles contracts, meiosis. What the sympathetic system does is mydriasis. It does dilation, but the parasympathetic system constriction, okay, meiosis. Skeletal muscle and plate, sorry, NM, NM receptors, and NN receptors. NM receptors is these receptors are present in autonomic ganglia and adrenal medulla. NN, whereas NM receptors are present in skeletal muscle and plate. What they do? Contraction of skeletal muscle. If we want to contract our skeletal muscle, we must stimulate the NM receptor. Then these NM receptors, okay, secretion of what can we say that ephedrine. Ephedrine. What's the name of ephedrine? What's the name of ephedrine? Adrenaline. Okay, it secretes the adrenaline, control the ANS totally. What we say? Direct acting, indirect acting. Cholinergic agonists are classified into cholinesters, alkaloids. Esters are acetylcholine, methacholine, carbachol, ventracol, alkaloids, muscarine, pilocarpine, aerocholine. Anticholinergics. These block the cholinergic activity. These may be of two types, reversible and irreversible. Reversible is particularly used for the treatment, whereas irreversible mostly is seen in the poison cases. Now, what's the main poison? Organophosphates poisoning is the main poison we are seeing now. Yeah, carbamates. These drugs are physostigmine, neostigmine, pyridostigmine, ephedronium, rivastigmine, doneprazil, glantamine, acridine, tacrine, carbamates, carbaryl, rubrax, all of these. Okay. Direct acting cholinergic agonists. Why these are called as direct acting cholinergic agonists? They act by binding directly to cholinereceptors. Do not readily enter the CNS, so effects are peripheral. Resistance to metabolism by acetylcholinesterase effects are longer acting with acetylcholine. Yeah, if we are able to add acetylcholine with these drugs, these effects can be longer. Methacholine, muscarine, carbachol, pilocarpine, methanol, aerocholine. Drugs effects of cholinergic agents. Cardiovascular effects. We can see that these causes the bradycardia, decrease heart rate, vasodilation, nothing happens. Stimulate intestine and bladder. Increase gastric secretions, increase gastrointestinal motility. So increase in total digestive activity. So by this, it may or may not interfere, but the urine frequency also get increased. Effects on people. Constriction, as I said first only, it's relaxing, constricting, spasm of accommodation, reduce the intraocular pressure, increase the outflow. What happens when we constrict the people? Yes, liquid material gets, not every case, but it sometimes the liquid material gets split out of the eye. So we can say that this decrease in intraocular pressure, respiratory effects, bronchial constriction, narrowed airways. So we do not give the cholinergic agents to the patients such as asthma. Okay, because there is already a bronchial constriction is there to them. So if we are able, if we are giving them the cholinergic agents, it causes them the more bronchial constriction, increases salivation and sweating, because these agents are stimulating the secreting glands. So I designed a pass, muscle up dog, MSLUBDD, muscle up. muscle up, muscle up, muscle up, muscle up. M stands for meiosis, S stands for salivation, L stands for lacrimation, U stands for urination, B stands for bronchoconstriction, D stands for defecation, and finally D stands for decreased heart rate. Last lab, MSLUBDD, MSLUBDD, MSLUBDD. These are the basics for the cholinergic agents. If you are able to learn these basics, you can get an idea to do something about this. Yes, actually, this is the secret behind it. MSLUBDD is not a code. I just remember it by a cute quote. Many smart ladies ultimately bring disaster for dudes. Yes, is this right or not? Yes, this is exactly right. Smart ladies ultimately bring disaster. So now we are coming to the individual drugs. Acetylcholine. One of the main neurotransmitter of ANS is acetylcholine. Acetylcholine, where it is released, preganglionic fibers. When acetyl-CoA reacts with choline, in the presence of choline acetyl choline acetyl transferase enzyme, it forms acetylcholine. Yes, also released from the post-ganglionic sympathetic neurons that innervate the sweat glands, and also from motor neurons that innervate the skeletal muscles. Yes, in parasympathetic system, it's released in sympathetic system, it's released, and its motor neuron also is released. It is a quaternary ammonium compound, so cannot penetrate the membrane. So why it cannot pass to the membrane? Because it's a quaternary ammonium compound, it cannot be able to transport. So it requires particular things in order to transport to the membrane. Do not have any therapeutical importance. Yes, it has therapeutical importance, but these are not more, because acetylcholine released in more quantity. Also, the anticholinesterase agents gets inactivated. It has both muscarinic and nicotinic actions. Means we can say that it can able to bind with muscarinic and nicotinic receptors. That's a call. As this cannot be hydrolyzed by acetylcholine's actions. This can stimulate the muscarinic receptors, causing increased intestinal motility. Muscarinic receptors means M1, M2, M3. These three. What M1 do? Increase gastric secretions or increase digestion, like that. It stimulates distractor muscle of the bladder, while trigone and sphincters relax, causing expulsion of urine. Yeah, it helps in the expulsion of urine excretion. Therapeutic uses. Paralytic ileus, urinary retentions, helpful for post-surgical anatomy of bladder, GI tract, urinary retention. Yes, I don't say about it. Pilocarpine. An alkaloid, pilocarpine. It is alkaloid, lipid soluble and stable to hydrolyze by cholinesterases. Actions: when applied locally to the cornea, produces rapid meiosis. Contraction of ciliary muscles produces. Yes. Uh, why this pilocarpine is used? Because whenever the intraocular pressure gets increased, there is a condition called glaucoma. If we are able to decrease the intraocular pressure, then we are able to treat the glaucoma. So, what this really does is rapid meiosis, means rapid constriction. If constriction is done, then the intraocular pressure is reduced. So, thereby causing the decrease of glaucoma. Therapeutic uses. In glaucoma, it opens trabecular meshwork around squamous canal, causes drainage of aqueous humor. IOP, intraocular pressure immediately decreases. These are the what if you see the glaucoma, you can really understand about the meshwork as well, as it takes more time to explain. So I didn't saying just I am saying briefly about the pile. Indirect acting anticholinergic drugs. Anticholinergics, sorry. These are two types, reversible and irreversible. They act through inhibition of acetylcholinesterase enzymes, so increase acetylcholine level in the synapse. What these do, I said previous acetylcholine is released in huge amounts, but it's get inhibited, it's get deactivated by acetylcholinesterase enzymes. So, in order to increase the levels of acetylcholine, we use cholinergic agonists or acetylcholinesterases. The name itself indicates acetylcholinesterases. Okay. Accumulation of acetylcholine then occurs, which enhances the activation of nicotinic and muscarinic receptors. Accumulation of acetylcholine then occurs if two neurons, if we are able to see the post ganglionic and preganglionic neurons, if there is acetylcholine, more number of acetylcholine, this can easily activate the nicotinic and muscarinic receptors. Anticholinesterase drugs are either reversible or irreversible inhibitors of acetylcholinesterases. So once I am repeating, please listen carefully. What acetylcholinesterase do? Yes, anybody? What acetylcholinesterase do? It simply deactivates the acetylcholine. If we are able to control this acetylcholinesterase, then we can increase the acetylcholine levels. How can we control? By giving anticholinesterase drugs. This is the thing why I'm bugging for this much time to present these slides. Okay, just understand the basic. Yes, these are the drugs. The main drugs are here: neostigmine, physostigmine, pyridostigmine, ephedronium, donepezil, irreversible or organophosphates, carbamates, physostigmine. Only anticholinesterase capable of crossing the blood-brain barrier is more lipid soluble, used as antidote for overdose of anticholinergics such as atropine, antihistamines, TCAs, may be used in the treatment of glaucoma. Okay, do you understand it? Rhodostigmine. This is the maintenance drug of choice with myasthenia gravis. Okay, myasthenia gravis. What is myasthenia gravis? Myasthenia gravis is a neuromuscular disease that leads to fluctuating muscle weakness and fatigue. In most common cases, muscle weakness is caused by circulating antibodies, autoimmune disorder, okay, that block nicotinic acetylcholine receptors. So, these block the nicotinic acetylcholine receptors. So, if there is no acetylcholine, so what happens? As acetylcholine is a main neurotransmitter, is not having, so neurotransmitter do not take place. In particularly muscles, it produces involuntary actions. So this is happens in the myasthenia gravis. Neostigmine, prototype anticholinergic agent used for long-term treatment of myasthenia gravis and as an antidote for tuberculin and other non-depolarizing agents in surgery. Donepezil, used in treatment of mild to moderate Alzheimer's disease, helps to increase or maintain memory and learning capabilities. Okay, I think I want to use the donepezil as it increases my capability. Use of indirect cholinergic agonists. Glaucoma, as I said, glaucoma, pilocarpine and physostigmine. Ephedronium, myasthenia gravis, neostigmine is the drug of choice. Post-operative paralytic ileus, neostigmine. Post-operative decorization, neostigmine. Reverses paralysis. Cobra bite, ephedronium, prevent respiratory paralysis. atropine poisoning, physostigmine, Alzheimer's disease, donepezil, TCS, phenothiazine overdose, physostigmine, cholinergic agent side effects. As you know, that every drug has a side effects. So side effects, a result of overstimulation of what? PSMS. Cardiovascular. Yes. What happens if it's overstimulated? Bradycardia. So leading to the hypotension, abnormalities such as trachea. It may, if you are unable to treat or if you are not viewing it for so many days, it may cause the cardiac arrhythmias, CNS, dizziness. It is relaxing. So you get dizziness, confusions, convulsions, headache, gastrointestinal tract, abdominal cramps, increases secretions. As the secretions are increased, and there is no food, it may cause gastritis. These may also cause nausea, vomiting. Respiratory increases bronchial secretions, bronchial spasms, more bronchoconstriction, lacrimation, sweating, salivation, loss of binocular accommodation, acute toxic effects, organophile of cholinesterase inhibitors, irreversible. So these are the main poisons. These agents are lipid soluble, can enter the body by the skin. So if you observe, comparing to the good, the bad can enter more quickly. Okay, just see. The organophosphate poison can enter the body by eyes, skin, respiratory system, gastrointestinal poison. What are organophosphates? These are nothing but insecticides or pesticides we are spraying in the fields. Okay, these agents cause excessive cholinergic stimulation and neuromuscular blockade. Cholinergic crisis occurs because the irreversible anticholinergic poisons bind to the enzyme acetylcholinesterase and inactivates it. So, if you are seeing cholinergic crisis occurs because irreversible anticholinesterase poison binds to the enzyme acetylcholinesterase. What acetylcholinesterase does? Yes, what acetylcholinesterase does? It simply deactivates the acetylcholine and inactivates it. Thus, acetylcholine remains in the cholinergic synapses, causing excess. Means more and more of acetylcholine. So more and more of acetylcholine leads to more stimulation of muscarinic and nicotinic receptors. So more, everything is getting more, increased activity. Treatment of organophosphate poisoning. Emergency treatment includes decontamination of clothes, flushing poison from skin and eyes, activated charcoal and lavage of. So these two, activated charcoal and lavage of GH injection, these two are done in hospital. Okay, as this must be the patient who taken organophosphate poisoning must be taken immediately to the hospital. Atropine to counteract the muscarinic effects. Yes, if you see, atropine counteracts the muscarinic. To relieve the neuromuscular blockade by nicotinic effects, get paroxetine, a cholinesterase reactivator. Paroxetine causes anticholinesterase poison to release the enzyme acetylcholinesterase. So again, the acetylcholinesterase is releasing. So again, it's get deactivated in the choline, acetylcholine. But there is a problem, boss. If you see, the bad enters quick, the bad action is quick, and bad absorption and reabsorption, everything is quick. But whereas the good takes so much time to work. So other auxins are there which are also given to the treatment. And finally, thank you for listening. For more videos, subscribe Mahidhar.formd. Okay. Bye bye all of you. Hope you enjoyed this video.